What is the scariest example of medical negligence you've seen? 1. When my son Garrett was 2 years old, he started complaining about belly and back pain when his legs were raised to change his diaper. I took him to the HMO pediatrician that took my insurance. The doctor said, just wanting attention. I was told to take his bottle and pacifier away and sit him in the corner when he cried. I switched him to a sippy cup, let him keep his pacifier, and he was comforted when he cried. He never sat in the corner. He got worse. You could visualize his liver, it was so swollen. Back to the doctor, who said to take dairy out of his diet and place on brat diet. He got worse and developed bilateral bruising in both eyes. Back to the doctor, who said he had no idea what caused that and didn't offer to research it for the diagnosis. I requested a specialist, got denied. He ordered tests but then canceled them all. He was misdiagnosed 7 times, and when he became paralyzed from the waist down, we went to ER. He was admitted, and the next morning he went into surgery to have a tumor removed from his adrenal gland. Afterwards, I was told he had neuroblastoma, had no chance of survival, but treatment would put him in remission and give him more time. He got chemotherapy and radiation and was in clinical trials. He had the rarest childhood cancer worldwide, and most children didn't live to see 4. He did go into remission, but when on his wish trip it came back. In his blood, bones, and tumors in both eye sockets. He died at the age of 4, at home in my lap with hospice there for support. The funeral home was called, and when they got there he had to force me to hand him over. I buried him with his dinosaurs and Power Rangers and wanted to climb in the coffin with him. He would be 25 years old now, and the grief never lessens or goes away. It's with me every day and still can bring me to my knees. 2. I was 6 months pregnant with a very healthy pregnancy. I went to get out of the car, which was not difficult at 6 months along. I swung my legs out and my feet touched the ground, then all of a sudden I was hysterically crying, snot pouring out of my nose, screaming in pain. Pain level 9. My husband got me to the ER, where I kept yelling at everyone that it hurt above my uterus and it wasn't pregnancy related. Up to the maternity ward they take me despite my insistence that it wasn't pregnancy related. I laid flat on my back and pain eased up to tolerable. Pain level 5. Red flag. A 6-month pregnant woman won't want to lie flat on her back. The baby checked out fine, just as I knew he would. This same scenario happened 8 times over the next month and a half, and no one would listen that it was not pregnancy related. Finally, on that 8th time I was admitted because now I'm seen as a pain med seeker and they wanted to do an early delivery because I'm now an unfit mother. Keep in mind that I have declined pain meds every single time they were offered. I wouldn't be able to describe my symptoms if they covered them up with pain meds. A new sonographer comes into my hospital room to do a long ultrasound to make sure the baby is making breathing motions so they could deliver early via C-section. This is my 3rd kid and I've only delivered vaginally. Before she came in I could hear the nurses telling her how I was just after pain meds and they were going to have a social worker take the baby as soon as it was born. So at this point I'm horrified. My mom, husband and 13-year-old daughter had just stepped out to get something to eat, so I was alone when I overheard the evil nurses. The sonographer gets set up with her machine and looks at me in the most loving and caring way and asks about my pain. I tell her everything because I'm distraught, angry and confused. I need to let it all out. I tell her no one has even examined the area in pain and it's been over a month. She asked if she can try to see something with the ultrasound. Yes, please! ! She puts the wand above my uterus, squints at the screen and says, "What is that?" Then she says, "Bear down." So I did, and she completely freaked out, ran out to the nurse's station and proceeded to yell very loudly at all the nurses about negligence and how could they do this to another human being. It turned out that an internal incision from having my gallbladder removed had ripped open and my intestines were bulging. I finally got to see a general surgeon and get some answers. He left my room door open so I could hear him chew out the nursing staff and my midwife. It was glorious. I delivered at 40 weeks with a very easy labor and delivery. The baby was perfectly healthy. The surgeon repaired the hernia and life is good again. 3. I had a 38-pound ovarian cyst removed when I was 16. You read that right? 38 pounds. The surgeon drained a total of 5 gallons of fluid, 18 liters, and reduced it to the size of a basketball before removing it along with one of my ovaries. The negligence wasn't on his part. It was a couple years before the surgery when I visited an urgent care clinic because of the severe pain I was experiencing during my menstrual cycle. The nurse practitioner barely examined me and gave me a prescription for IBS and sent me on my way. My poor dad, who was raising 2 girls on his own, didn't think to question the diagnosis since female puberty wasn't his strong suit. I just dealt with the pain and tried to lose weight. People were always asking me if I was pregnant. 2 years later, I was one of 7 passengers in a 4-door sedan that was involved in a high-speed accident. No one was seriously injured because we were packed in like sardines. But my dad wanted me to go get checked out anyway. The nurse at the ER thought I was pregnant, and I said, "Unless I'm the next Virgin Mary, there's no way I'm pregnant." She didn't believe me and made me get an ultrasound, and that's when they found it. 2 weeks later, I had surgery. I was told that even though it was benign, it would have crushed all my organs within a year. It started when I was about 11, so, for 5 years, it just kept growing. I didn't realize how much pain I was in until it was gone. That car accident saved my life. 4. My mother's. She kept going to the on-site clinic at the university where she worked as a janitor, where all of the employees were encouraged to go because of lower co-pays. She was having pains in her arms and back that kept getting worse. She would call me, telling me, not really complaining, as that wasn't her way, that it was a strange pain that was all the way to the bones. Her PCP was a young, male doctor. I've never met him, but I like to imagine he had a handsome, punchable face. Every time she went in, He and the nurses would laugh off my mom's concerns. "You're not getting any younger, you know. Here are some NSAIDs, it's just arthritis." This went on for months, even when my mom would tell them that the pain was so bad she couldn't physically turn the steering wheel in her car. No blood work, no x-rays. Finally, it got so bad my sister convinced her to go to urgent care. One x-ray showed her bones lit up like Christmas with tumors. Stage 4 multiple myeloma, over 95% of her bone marrow involved, the most aggressive genetic variant. Over 2 years, she underwent 5 stem cell transplants, lost all her vitality, became a shell of the woman who had navigated a lifetime of trauma and abuse with humor and compassion. She died on a Saturday. It was cloudy and cold, and I left my 6-month-old daughter 1,000 miles away to be at her bedside. My beautiful daughter who has her curls and her mischief, and the same stubborn tenacity. My brilliant daughter who has no memory of a grandmother who would have set the moon in the sky for her. All because some arrogant doctor didn't believe a middle-aged woman and didn't want to bill the university's insurance plan for an x-ray because come on, she's probably just overreacting to some arthritis. After all, she was just a janitor. What could she possibly know? 5. I knew a lawyer who represented a young lady in her malpractice case, and 1. She went skiing, crashed and broke her leg. The doctor set it and cast it, and sent her home. She kept complaining of extreme pain, but the drive told her, of course it hurts, it's a broken leg. Finally she called again and said it still hurts, and now it stinks. They brought her right in and found the leg had gotten gangrene. Bad, right? So they have to amputate the leg. During the amputation surgery that lasts many hours, the drive moved the good leg off the side of the table, which cut off the circulation, and for that many hours, killed the good leg. It too was amputated shortly after. She won a 7-figure settlement, but I can't believe it was nearly enough. 6. A friend was unable to pull her tampon out. She went to her doctor who also could not pull it out, but said that it would eventually come out on its own. I made an emergency appointment for her to see my doctor who discovered that lesions had formed holding the tampon in place. He managed to remove it. I wanted to go to her first doctor and say, have you never heard of toxic shock? She wouldn't let me, but I was angry that something as potentially lethal was ignored by a doctor. 7. I was administering an anesthetic to a patient for a hemi knee replacement. The surgeon had less than desirable skills not only in surgery but in life in general. The patient was a Medicaid recipient. He did an extremely poor job repairing the knee, such that her knee bent out at a 30-degree angle. I came from an orthopedic background and was appalled by his actions. I finally spoke up when I realized that he was going to close and leave her knee like that. I told him that I would refuse to wake this patient up until he corrected his mistake. Everyone in the room was scared at this point. He said, just what do you think that would accomplish? I told him that I would require the hospital director and the chief of surgery to come to the OR and witness his malpractice. He corrected his mistake. If he cared so little about Medicaid recipients, he should not take them as patients and should not accept the government, taxpayer, monies he received. The case law has shown that the anesthesia practitioner who renders the patient unconscious and therefore incapable of making informed correct choices must act as their advocate.